This sign indicates high cortisol. In this video, I'm going to tell you the 11 main signs and symptoms that will show up in your body when your cortisol is elevated, which we call hypercortisolism. I'll explain this to you in more detail. What motivated me to talk about this topic is that there are a lot of myths here on the internet. And as a doctor who specializes in cortisol, I'm a doctor and endocrinologist, I'm going to bring you a lot of scientific information about this. So, what are these 11 signs and symptoms? But first, I want you to understand that the problem isn't just having high cortisol, but when that cortisol stays elevated. And the cortisol production happens without a stimulus, without any real reason. For example, when you get stressed, when something happens, when you have a test, for instance, it's normal for your body to produce more cortisol. When you have an infection, like the flu, for example, your body will produce more cortisol. That's normal. I want you to understand that's not a bad thing. It's a physiological response. It's a natural response from your body to these situations. An increase in cortisol, so this is actually beneficial. It means your body is working properly. When you wake up in the morning to regulate your circadian rhythm, your cortisol is also elevated. That's not bad, it's physiological. It only starts to become a problem, causing those signs and symptoms, when your cortisol production stays high throughout the entire day. When you're at rest, when you're not stressed, like when you're about to go to bed, for example, that's when we have a big problem because this is outside the norm and will cause a lot of consequences in your body. So, not all high cortisol is bad. We've already seen that there's this aspect here that's actually beneficial to protect you in certain situations. This is the mechanism called fight or flight. So, to protect you, the body increases cortisol, but under normal everyday circumstances, it should be higher in the morning, and as the day goes on, cortisol levels drop and reach very low levels at night and during sleep. That's how our circadian rhythm works. And what are the signs and symptoms that your cortisol might be high? In a pathological way, there could be an illness behind this. The first sign, and this one is a pretty suggestive sign of high cortisol, is the appearance of purple stretch marks. Those big purplish stretch marks. I'll put a picture here, it's easier to explain that way. So it's not just any stretch mark. Those small white stretch marks, for example, that's not from high cortisol. Now, this kind of stretch mark here is suggestive, and it requires further investigation. It's really important to pay attention to these signs and symptoms because many patients suffer from high cortisol and they don't get diagnosed because it's hard to make the diagnosis. If you don't pay attention to the signs and symptoms and don't seek specialized help, it's going to be very hard for you to improve from this disease you have. So many consequences for your body. So, purple stretch marks are the first sign of high cortisol. The second are bruises on the body, the ecchymosis. You know when you bump into something and it leaves a bruise? If you bump into something, for example, you hit your leg, it's normal to get a bruise there. But when you have this more than usual, or when you start to not knowing where these bruises, these ecchymosis came from, now that's when we have a problem. And this can also suggest elevated cortisol, because cortisol is also essential for our blood clotting. If you have a cortisol problem, if your cortisol is high, it can cause this issue, which is the appearance of bruises on your body. Sign number 3 is an increase in blood sugar levels. Did you know that this cortisol disorder can even cause diabetes? Because that's one of cortisol's functions, to raise blood sugar levels. If you're diabetic, you know what happens when you get stressed, right? Write it here in the comments and also mention your type of diabetes. So what happens then? Your blood sugar levels will go up. Now, when you have an unchecked production of cortisol, this can even cause diabetes. It's as if your body is always stressed, always ramping up the cortisol. This will throw off your blood sugar levels, possibly causing diabetes or making an existing diabetes much worse. This is a major warning sign. For example, let's say you have diabetes and you were well controlled with ideal blood sugar levels, ideal hemoglobin A1C, and then suddenly you didn't change your routine, you didn't change your diet or your physical activity, but your levels started to go up. Whoa, that's a sign you need to check your cortisol levels because this could be the reason for a major worsening of existing diabetes or even the cause of new diabetes. Just look at the magnitude. Look at how important this sign is. So, this is a big red flag for changes in blood sugar levels. Sign number 4. Did you notice I showed a sign on the face earlier? If you're curious to know what it is, well, the face can be a huge clue and can really help with the diagnosis. Because increased cortisol has a specific effect on the face, which is what we call a moon face. The face becomes rounder. And along with that, I'll add here that high cortisol can cause what we call centripetal obesity. What does that mean? That's when the obesity is concentrated in the trunk area. So, with thinner arms and legs and a lot of fat in the abdominal region, there can also be another finding, which is the buffalo hump, a buildup of fat at the back of the neck, in that part of the neck. So, this right here is a big warning sign that cortisol might be elevated. So, the face is very important, okay? It can reveal problems with cortisol. Sign number 5. And here, I'm going to break down the sign for men and for women. In women, we can see menstrual irregularities, irregular cycles, and a woman might even stop menstruating altogether. We can also see a decrease in libido and changes in estrogen and progesterone. Why? When cortisol levels are elevated, it can inhibit the production of key hormones that regulate menstrual cycles and hormone balance in women. LH, which is luteinizing hormone, and FSH, which is follicle stimulating hormone. And in men, what can we see? In men, a reduction in testosterone and also a low sperm count. It can even cause infertility. Look how important this is. So, whenever I come across a case of low hormones, like reduced testosterone, or in women, changes in the menstrual cycle, this investigation is essential. Before starting any kind of treatment, you need to have a diagnosis. So, it's common in the office. See patients who are already using testosterone, for example, in the case of men, without investigating the underlying cause. Because many times, by treating this underlying cause, in this case, elevated cortisol, the hormone levels return to normal. And then you really have a much better chance of improvement instead of just having high cortisol, correcting the testosterone, and ending up with a bunch of other problems. Because you didn't treat the root cause of the problem, right? So, cycle menstrual changes, reduction of these hormones, and in men, infertility, changes in sperm, and also in testosterone. Sign number 6, changes in immunity. An increase in cortisol, that pathological, disease-related increase, can alter function of the defense cells. You can do a blood count test and you'll get the cell count. This blood count test, it won't show that. Why? Because this increase in cortisol can harm the function of the defense cells, not their number. Did you catch the trick here? That's because this blood count test won't tell you about function, only about quantity. It's a quantitative test, not a qualitative one. So this parameter here, we can figure it out by asking the patient and analyzing. The patient's medical history, analyzing what happened to this patient. For example, the patient caught a virus and had a more severe form of it. Whoa, that's a warning sign that something might be wrong with their immunity here. And not just by ordering a blood count test and thinking everything is fine, it can even give a false sense of security. Sign number 7 is that increased cortisol, it can increase the risk of thrombosis, especially deep vein thrombosis, which is thrombosis in the legs. You end up with a more swollen leg, especially in the calf area. This can be because of high cortisol. Of course, thrombosis has several other causes, but one of those causes is, indeed, elevated cortisol. What can cause thrombosis? You might become immobilized. For example, you might have a fracture and can't move that leg very well. Other diseases increase the risk of thrombosis, like blood clotting disorders. There are several other causes, but I couldn't leave out that when we can't find any cause, we have to investigate. Yes, the cortisol factor, especially if there are other signs and symptoms, because it can happen to people with elevated cortisol. What is thrombosis? A lot of people ask, thrombosis is when a clot forms in the deeper veins. And what's the problem with that? That clot, that thrombus, can travel through the bloodstream and end up in the lungs, causing a very serious complication called pulmonary embolism, or pulmonary thromboembolism, which is when there's a clot in the lung. This compromises gas exchange, and your lungs can end up without being able to perform their function, which is to oxygenate our blood in our body, causing a very serious complication. Sign number 8, and this one is also very important, is that increased cortisol can raise blood pressure. In fact, just like I mentioned with diabetes, increased cortisol can cause high blood pressure. Look, how interesting is that? Or it can make existing high blood pressure even worse. So, sudden changes in blood pressure. You also need to look into this cortisol issue. Why is that? With blood pressure medications, sometimes the person will take 3 or 4 different types of blood pressure meds, and it still won't solve the problem because the real issue is the uncontrolled production of cortisol. So, increased blood pressure levels, known as hypertension. Sign number 9, and this one people rarely associate with changes in cortisol, which is changes in the bones. And I'm going to highlight osteoporosis. The bones become weak, they get porous. There's a change in bone mineral density. It's really important to consider elevated cortisol because if you don't treat the root cause, you can try using other medications to restore the bone, but it won't work since the problem is somewhere else. So, for example, fractures. And I want to point out that not just any fracture should raise a red flag for high cortisol, but rather fractures that can't be explained. For example, you had a low impact fall that shouldn't have resulted in a broken femur, but it did. Whoa, what's going on with the quality of that bone? Or a vertebral fracture, for instance. You don't even know what you hit, so you need to investigate. When it comes to bone issues, the most common hormones involved are these, and also the issue of cortisol. Sign number 10 is muscle weakness. But let me be more specific here. It's proximal muscle weakness. What does that mean? You have trouble getting up from a chair, for example, or even hanging clothes on the clothesline. Those kinds of movements, which we call proximal muscle weakness. This is very suggestive of a change in cortisol. It's a type of weakness in those muscles. So weakness when getting up or doing any activity where you have to raise your arms, that's also a warning sign. Remember that pattern I mentioned in sign number 3? And sign number 11, our last sign, is swelling, especially in the legs and feet. You know that swelling can have several causes. It can be caused by the kidneys or the liver, by the heart, for example, but high cortisol can also cause this swelling. Would you like to know how high cortisol is diagnosed? If you want, I can make a specific video about this because it's a very specific topic. There are a lot of details. It would be more of a video for doctors. If you want, I can do it here, post it here on the channel. It would be around 45 to 60 minutes because diagnosing high cortisol requires using medications to test during the exams. There are also imaging tests to look for where the possible cause of the high cortisol might be. There are several places in the body that could produce this, other hormonal tests as well. So it would be a video of about 60 minutes. If you want to watch this video, I'll make a video on this topic, but you have to write it here in the comments. I want part 2 about cortisol, the tests for diagnosis. I'll prepare the content. It's going to be a lot of work, but if you want it, if that's what you want, I'll make this video. Also, write here which part of the world you're watching this video from. I'm speaking from Porto Alegre. Now, I'm going to leave a recommendation for you to watch. It's the video where I talked about vitamin B12. Do you know how to recognize the signs and symptoms of vitamin B12 deficiency? There are some really specific signs that can really help with diagnosing this serious issue, which, if left untreated, can even lead to dementia. Look, just how important this is. In this video here, you'll find information about the signs and symptoms. Take care. See you next time.